everyone. Welcome to Health Live at Seniors Today. We've been doing, we've had perhaps 275 to 300 sessions of Health Live, but in this entire journey, and all the sessions are, as you know, for senior citizens. But I'm not very sure what the reason is, but we've not had too many sessions on geriatrics. We've had two or three doctors who who are specialists in geriatrics, but just about that. Though, of course, each and every session is meant for senior citizens. But once again, today we have a specialist, a geriatric specialist, an MD in geriatrics, who's here and whom we've invited to speak about aging gracefully, health tips for a vibrant life, and managing chronic conditions. Let me introduce our doctor today, Dr. Virajrao Kore. He is a consultant geriatrics at the Ruby Hall Clinic in Pune. Let me introduce him. Let me talk a little about him. He's been practicing as a geriatric physician at the before the Ruby Hall at the esteemed Amrita Institute, AIMS at Kochi, after having completed his postgraduate training from the same institute. As a junior faculty member at the Department of Geriatrics under the able leadership of the HOD, Dr. Priya Vijaykumar, who is trained he's trained postgraduate, undergraduate, and paraclinical staff in various aspects of the care of the elderly. He's been part of clinical rotations, research, and quality improvement work. He was appointed clinical lead in the AIMS Falls Prevention Initiative. As you know, we've had a session on falls prevention in the past and work very closely with nurses, nursing staff, PMS staff in auditing and preventing hospital falls, especially in the elderly. I could go on and on about his achievements in the past, but his core area of interest lies in polypharmacy management. Once again, we've had a session on polypharmacy, which is managing the various medicines that you have, cognitive impairments, frailty, among many other geriatric syndromes. He's a life member of the Indian Academy of Geriatrics, British Geriatric Society, and the IMA. He has multiple publications to his credit and has presented papers at various national and international conferences, winning him a podium presentation at the BGS London Annual Conference in Feb 2022. And of course, he's won many accolades in the academic and personal domains. He is also an avid badminton and TT player and represented his college on various things, and of course has various pursuits which are philosophy and literary. Welcome to Health Live at Senior Today, Dr. Kore. How are you?
Thank you. Thank you so much for having me. I'm wonderful. Great to hear from you, sir.
Thank you. Before I request you to do a presentation, which will be there for around 20 minutes, tell me, obviously most hospitals these days have somebody who's a geriatric specialist, but is this is this because a geriatric specialist is a jack of all, or is it something that is not given its due by the medical profession in the country, or is it just about getting its due?
I think I'll stick to the later aspect of your comment. I think to just be politically correct here. Again, because geriatrics is at its inception and there are a lot less number of people working in the care of elderly domain. So I think the time will come. The next few decades are, in fact, I'll be talking to you about in this presentation are of the elderly. So yes, so that is how we are going to have, progress ahead. And geriatrics as such is a very naive department and specialty of medicine in India, but in the West, it's already an established one. So yeah, good times to come ahead. All I could say.
The fact that somebody like yourself has chosen geriatrics amongst various fields that are available, does show that there is, if I might use the word achhe din aane wale hain, for geriatrics. But however, the fact of the matter is that senior citizens do require special care, and I think I'm so glad that there are doctors like yourself and amongst the younger breed of doctors who are choosing geriatrics for this, because focused attention for seniors is important, which is as we all know, it's a large strata of our population. It's young 18 to 24, 34-year-olds is the largest segment of society, but seniors is rising. Seniors are there. We have over 100 attendees today who are all there waiting to hear you, waiting to see your presentation, and then ask questions. Over to you. As you can make a presentation as Dr. Virajrao Kore makes his presentation. Please, please keep your questions ready and put them in the chat window, and we will address them. I will address them to Doctor after his presentation is over. As you know, do not worry about taking notes while he's speaking, because this video will be there on the Seniors Today website on Monday evening, so you can take a look at it, make your notes later, and equip yourself with all the knowledge that is needed to be. Over to you, Doctor.
Right. Thank you so much, sir, for your kind words. And my namaskar and humble greetings to everyone who is gathered here and digitally. So as a medical doctor in caring for the elderly, I have a few small, simple, logical tips which I would want to share with you. I believe most of the audience is elderly and senior citizens. So without wasting any time, let us just dive into the presentation. So yeah, my humble greetings to everyone and everyone. And I bring regards from the Ruby Hall Clinic. I would especially like to thank the marketing team for setting this up. Right. So what is geriatrics? I mean, this is $1 million question I've been getting asked a couple of times. I mean, geriatrics has been evolving, so as to say. Traditionally, we had this model of care versus cure, which is already many a times gets trampled upon because of this advent and exploits of modern medicine. And the whole purpose, the patient who is the center of it is somehow is ignored. So what I feel about geriatrics is basically a homecoming branch of internal medicine, with the basis being recognizing and managing the geriatric syndromes, the geriatric giants, what we call them, comprehensive geriatric assessment, and other models. So this is how geriatric works and works upon. Right. So when we talk about the current model, which we are speaking about, we look at individual diseases. I mean, this has been a notion. It's a silo approach towards many problems, medical problems, especially. This has to somehow get replaced with a holistic kind of a way, which is the whole crux of what geriatric functions on. And with its first rule being function and maintaining independent functional ability. So as to summarize what geriatrics is for you. We are not new to this change. I mean, if you just look upon, if we look at the next 30 years and what is going to be the next global change, so you could enlist climate change, the rise of sea level, I mean, so on and so forth. But this unprecedented demographic transition that we're going to encounter in the next couple of decades, I mean, this is going to be very striking and starking too. And geriatric, why does it matter? Because it is going to shape how elders are going to be cared for in the future. So the next 20, 30 odd years are going to be the game changers when it comes to care of elderly, what I would suggest. And when we speak about India, in the Indian context, by 2050, we are expecting 1 in 5 individual to be 60 and above, which amounts to around 30 crore individuals who are 60 and above. Am I being audible, very clear and crisp?
Yes, you are. Yes, you are.
Perfect. Great. So here I bring to you this concept about the constriction in the morbidity. I mean, what is currently happening now is people are living longer, but the end of their life they're getting diseased or disabled and having a lot of morbidity. So the ideal goal here is to just constrict that morbidity towards the end of the life, right? So what it means is we'll be having a lot of longevity dividend, and which is basically a lot of savings in the global scenario, which by postulates comes to around $7 trillion by around 2050. I mean, if we could focus on living longer better, I think we are doing a lot of public service here, and this also amounts to caring for the elderly in a right way, in a holistic way. Great. So you heard about these blue zones. I think I'll just skip through this. These are the areas in the world where they live more than 100 years. So what was the key takeaway from this was these four things. I mean, all of them, if I can enlist to you, you can read them. Stress being an enemy of the elderly. So, so this has been deduced from the studying these people. Just to I mean reiterate this fact. I mean, taking a simple walk out of friend will sort out most of the activities, and walking will do good with the physical activity, the mental discussion, stress will be relieved. So yeah, and sticking to the healthy diet. So these are the simple basic things, yet a lot ignored, right? So about our presentation here, I have quick tips and tricks. I'm sure most of you who are here are already I mean, have their own tips and tricks, and I would in fact love to learn and know from them. But as a medical doctor, I have some things which might interest you, which could in fact you could use it in your day-to-day life and could make a difference. So that was the whole purpose of my presentation today, right? So I got these images from AI, which I would also want to put into this. And right, so number one trick or tip I could give every one of you is to embrace lifelong learning. I mean, this is one thing which all of us, especially the ones who are aging, should embrace. And it is not just elderly; it is us also, and younger generation. You'll be surprised, in fact, to know that currently the young workers are turning old. They are getting outdated. In fact, I am 34. I used AI to make this presentation. I mean, I never knew about what AI was, artificial intelligence was. So this is how we keep on learning and embracing new technologies. So if you could, I mean, I don't want you to scan this, but if you are competent enough to scan this QR code, this QR code, anyway, just to tell you, this tells you about how lifelong learning helps you. But if you are able to do this procedure by your own self, I think you have already learned the trick of the trade here of lifelong learning, right? So there is a lot of new things that we need to learn and embrace, which is the coming up of AI, the stock market things, and so many things I couldn't list. So yeah, that was my first tip, if that made sense to you. Secondly, the nutrition and diet. I mean, this goes beyond saying how important diet and nutrition lies in our elderly lifestyle, elders' lifestyle. And one of the primary thing is water. I mean, we tend to ignore it. Staying well hydrated is such a vital thing. What happens with aging is generally our normally around 60 to 70% of our body is comprised of water. As one ages, the composition of the body water reduces. I mean, you are already predisposed to dehydration as you age. I mean, and even on top of that, if we consume less amount of water, you can imagine, I mean, dehydration is something that we can easily just picking up a glass of water and hydrating yourself is so simple that anyone, all of us can in fact do. And it is recommended that we take around 1.7 liters of water a day, based on again the medical conditions involved. Secondly, fiber, which is again an ignored aspect. So these are few guidelines which I could quote. For men, it is around 30 grams of fiber per day, and for women, it is around 21 grams. So this is the recommended fiber intake that all of us should consume. Just to give you a grasp of this, 2 carrots has around 6 grams. So you can do the math. So this was about the fiber. Next is I want to focus your attention on mind diet. I think you all can browse about this after our presentation, but this is one diet which is shown by evidence to, in fact, delay the dementia and Alzheimer's disease. So it comprises both DASH intervention, which is for the hypertension, and the Mediterranean intervention, diet intervention for the dementia. So I have a quick screenshot if you can want to take. So what are the foods that comprise good foods and worst foods? I mean, so to to put it simply, I mean, food containing a lot of antioxidants, something with a lot of fiber, something with healthy fats, lean proteins, and water is something that is always recommended. And yeah, adding turmeric in your diet also has shown to delay neurocognitive dysfunction with aging. Berries are said to be superfoods also as part of this mind diet. So you can read about this and browse about this after as a take-home message for you. Right. So the third part of my tip was resources. I mean, all of us should be aware about various resources that are available for the care of elderly in the market as well as general. For those unversed, Government of India, as part of the Department of Social Justice, has this helpline number. I think most of you must be aware or not aware about. So this is one number that you could help dial if you're in any state as a senior individual to get more info about certain things. Secondly, good fellows. I think you might have heard about these are accompanying services or attendee services. I mean, these are a group of set of young individuals who uh, act or are I mean, they provide companionship to a senior citizen to do your simple day-to-day activities like bank activities or maybe buying groceries. So these are present. Such services are present in the metros. Similarly, there are a lot of NGOs that are working in the care of elderly. I just wanted to let you know that there are many such resources available online. Yeah, so this brings me to embracing aging. This is sadly is something that we don't in fact embrace aging. We want to be young. So this act of graceful aging lies in embracing aging. I mean, it is more about the feeling in physical aspect, emotional aspect, and mental aspect. It is not those fancy surgical cosmetic surgeries or high the new tech meds or the drugs which actually defer aging. It is accepting and feeling good about yourself, and this lies at the crux of graceful aging is what I feel. And just loving thyself and accepting yourself is something that as a tip maybe I could give it to you. From the medical point of view front, safety first. I mean, falls is such a big issue in the elderly. If stats are to be understood, every third individual or every fourth individual above 65 has a fall. I mean, falls is such a big medical entity in itself. And osteoporosis being one of a deadliest silent killer, which is basically the bones being brittle, is responsible for a lot many fractures with simple or trivial falls. So this is Dr. Bernard Isaacs. He was the one who coined the term geriatric giants. He said it very rightly back in 1980s. He said that it takes, sorry, not 90, 1800s. So it takes child a year to acquire movement and 10 more to acquire independent mobility. But an older individual can lose both in a day. So falls plays a very important aspect, and preventing and taking care and being very safe about not falling and having your bone strength ready and good, getting your B12, vitamin D, calcium levels in check and at in the normal ranges is so important. So also screenings. I mean, there are hosts of medical diseases. To name a few, I could say abdominal aortic aneurysms, tumors, cervical cancers, so colorectal cancers. So there are lung cancers. So there are tests which are available, which are endorsed by the American Society, also the Preventive Task Force Society, which actually helps us to screen for all these conditions in a timely and orderly fashion. So it is this the threshold is based on the age. So doing a simple ultrasound can help you detect whether someone has an abdominal aortic aneurysm. So yeah, so these routine screening should also be part of our health check and geriatric assessment. The most important aspect of the presentation is polypharmacy. I mean, very dear topic to me. Medications. We have patients who are on. You might have seen 20 plus and medications at a go. These medications, uh, they are a boon by modern medicine, boon to modern medicine, but end of the day, they are chemicals. I mean, they produce a lot of side effects and they interact among themselves, leading to lot many medical side effects and complications in the elderly. So a sane clinician should actually optimize medications, if possible, reduce them. Uh, and the elder guidelines say so many medications are in fact not indicated, and guidelines for deprescribing of these medications are in place. So we should follow them and try to be very safe and very clear about the what medications goes into your body. So this was one of my tip. If you are having more than say 5 medications at a time, you are having polypharmacy. So this is a time when you should actually intervene and ideally consult a geriatrician or someone who is aware about these issues. Right. So health checkups, which are regular, Ruby Hospital and many other hospitals have specially designed or tailored health check packages for elderly, which look at specific tests, like, for example, thyroid and B12. We spoke about them. Simple CBC, which looks at hemoglobin level, can help get a lot of details about the current functioning of our body. So I would recommend someone above 65 does this annual health checkups, which don't cost more than 10K to 15K combined, which includes so many other aspects also, a consultation with the eye doctor as well as other things. So for this you could consult your local doctor there, right? Then medical conditions. I mean, you'll be surprised to know that elderly uh, all over the world, I mean, two or more comorbidities are present in around 50% of the individuals. So managing them well is the bedrock of what geriatric medicine, the medicine aspect of geriatrics lies in. Uh, Aging per se is considered to be a strongest risk factor for all age-related diseases, and aging does drives many diseases. It is said how to deal with this is comprehensive geriatric assessment. So this holistic kind of a approach of looking towards many diseases is something which is a USP of geriatrics, I would say. And ideally, someone having multiple medical conditions should get themselves a comprehensive geriatric assessment done. I would not go into much depths of them because it is a different, it is a entirely different, entirely a medical and this kind of a discussion then. Yeah, so this brings me to an important tip: social connections. I mean, socially we should be sound. We should be fitting into this social sphere very adequately. You, all of you, being part of this club or part of this discussion in itself is a uh, I would like to congratulate you that you are being part of this social connection and keeping up well with this aspect, because social issues are so commonly seen in elder population. Social isolation being the most common one, which leads to multiple mental conditions like depression and even dementia if it progresses over a long time. So being socially connected, volunteering yourself, or interacting with your friends is something that is highly recommended from medical point of view too. Next, cognitive fitness. I mean, this uh, is equivalent to exercising your body. I mean, brain exercises are something that we never we ignore, and so like, what we can do about this is learning a new skill. Okay, maybe simple thing as brushing with your left hand rather than the right hand, which you normally do. So these kind of tweaks in your approaches can actually help a lot in actually exercising the brain and being cognitively fit. So let us play a quick game here. I mean, I have displayed to you these three random objects. I mean, one being a plant, another being a capsicum, if I am not wrong. Yeah, capsicum. Third is a alarm clock. So I would urge all of you to just take a mental snapshot of this image, and I would be asking you if you remember these three images, and if you could remember all three of them, you're already well and good to go. right? So take a quick mental snapshot of these images, right? Then the technologies has advanced so much. We have telehealth and telecare services available. uh, because of COVID, we utilized this option a lot, and so all of us should be aware and be able to access this benefit. This brings me to vaccination. I mean, this is one aspect which is ignored, not just at the community level, but at healthcare level also. You all know about pediatric vaccinations. We have multiple of us must have taken them. But are you aware about vaccinations to be taken for elderly? So recently, Indian guidelines came up with consensus guidelines came up with different sets of vaccinations to be given to those who are above 50 and to your surprise, maybe there are around 16 odd vaccines which can be given to uh, senior citizens or 60 plus individuals. So, uh, COVID being just one of them, there's so many other ones like herpes, and the list goes on. And we would like to discuss about them in a later discussion, maybe. So, but I just wanted to let you know that there is vaccination for elderly, and maybe you can contact your healthcare provider for the same, for the details about the same. Which brings me to physically active, staying physically active. A lot has already been said, and all of us know how being physically active is so important. Walking 7 to 10,000 steps a day is at least something that is very doable and has been shown by evidence to delay or, in fact, prevent cognitive decline. So they say traditionally walking around 20 minutes of brisk walking a day is ideal. Along with that, I think doing some resistance exercises, using your own body weight to strengthen your muscles is also equally important. And doing a simple balance test like standing on one leg, just maybe if you could just get up, maybe stand on one leg and with support. So this keeps us mobile. This keeps us balanced. So avoids a lot of fall related injuries and falls in the elderly. So this is one simple tip which I wanted to share here. Sleep is another issue which is very commonly seen in elderly. I mean, if you ask me if the number of patients that we see, maybe out of 10 people we see around 5 to 6 individuals have sleep issues or maybe more. So you should address this sleep bang on. I mean, it is said by the National Sleep Foundation that if you are above 65, you need around 7 to 9 hours of sleep. And say if you are having lesser than that, and most of our senior friends, they sleep a lot lesser than this. So which is again responsible for so many things, feeling fatigued and uh, tired and depressed. So if sleep is an issue, if you're sleeping less than this set number of hours, I think we should take it seriously and get it evaluated. There are these are the common sleep problems that we see encounter in the clinical practice, and the simplest treatment for them is following sleep hygiene measures. Now, sleep hygiene measures are basically keeping the room environment at ambient temperature, avoiding caffeinated products in the late night, following a set ritual of sleeping and waking up times. So, sleep hygiene measures are so important in having the sleep disturbed less life for the elderly. Right. So, do you remember those three random items we showed on the screen sometime back? I would not ask you individually, but if you could, uh, all congrats and kudos to you. Uh, so, the three items were a plant, a capsicum, and clock. So, if you scored 3 out of 3, I think you're already very good to go. So this is the last part of our presentation is advanced care planning. Uh, this is something that most of the medical professionals also and uh, are not aware about. I mean, but as a sensible and sane elder individual, we should all be prepared for this. This is what is advanced care planning. I mean, it is to tell you in brief. It is something. It is equivalent to a legal will, which is the healthcare proxy, But this comes into practice when you lose your capacity to decide for yourself. Okay, so now the government of India, the Supreme Court has made the process of making living wills or the decisions regarding withholding all the life saving measures very simple, and the hurdles have been removed a lot. So I think I recommend you use scan this code and from the Pallium. So it has a clear set of directives as to how you can decide for yourself about the advanced directives, and it is very self-explanatory kind of a document wherein you can decide for yourself what all things you as an individual want from a medical personnel when the time comes that you lose capacity to decide for yourself. So this is something that all of us, senior citizens, should document and get it verified, cross-verified with your doctor. Yes, so we are at the end of the presentation. Aging. This is a portrait by Elder Kana the Senior. So this is the fountain of youth. Basically, this is a mythical fountain of youth which is said to be present in some part of South America, I think in the Bahamas, I guess. So this desire of individuals to stay eternally or stay or to expand your lifespan has been uh, everyone's prophecy or everyone's liking since times ago. Where are we now? So the whole point is living better longer. I mean, we want to live longer, but we want to live better too. So this brings us to the anti-aging part of the medicine. I mean, this is where the modern or the new medicine is heading towards. And anti-aging, uh, as such, anti-aging is a misnomer, because aging is still not recognized as a disease by the FDA. So if we are to go into the depths of anti-aging medicines or anti-aging therapies, aging should be considered as a disease. I mean, which is again a question of I would leave that up to you to decide. I mean, aging, is it a normal phenomena or is it a disease? And if you want to look for yourself, this is one document that I would like to share with you. Yeah, so, but I am very positive that we are at this threshold of revolution in geriatrics, also in the developments of these medicines with bated breaths. And I would leave you on this note, and I am very welcome to answer any of your queries and suggestions. Thank you so much for patient listening. Thank you so much.
Thank you very much. Thank you very much. I think very, very detailed presentation. It is interesting that you have this last slide, which is of coffee, and if you can just switch off the thing, so we will have your focus on your on yourself.
Yeah.
You can shut the.
Yeah.
So, is this a quick case of smelling the coffee, as they say? That one has to be aware of the fact that you are senior and you need to be ready for a new life and not the same as what you were, say, 20 years back. Is this an issue which you think people have, that they think from their brain they want to be as energetic as they would like to be, but however their body doesn't allow it, and they need to start listening to their body? Is that something that you feel with a lot of seniors?
Um, what I feel is the whole point of aging gracefully lies in the feeling, how you feel about yourself, the attitude that is important, the way you deal with aging and the diseases that come along with the aging. So, having the right attitude, which all of us should work upon at a very strong level. Mm, yeah, so this is what I
Great.
could think of.
Thank you. We have quite a few questions that have come in, so I'll just ask them as quickly as possible, as well as there's Hina Mehta and Manish Mehta, who have asked about how much water, kitna pani pina chahiye. Manish Mehta has said water intake, it said in the video, should be 1.7 liters. If anyone has more, say 3.5 liters, will that be okay?
Yeah. So 1.7 is a is a general blanket amount of water prescription was recommended. But again, it depends on the medical conditions also. Someone who is having some heart related problems like a heart failure or a kidney related injuries, so you cannot hydrate too much also. So this was for our routine purposes, but taking around 2 to 2.5 liters of water is generally recommended for someone who is aging healthily.
Right. There's Mr. Jambunathan who asked, do we have an organization like the NHA in the US to take care of elders? Is that something that is being planned at all, since you may be knowing?
uh, NHS, I did
Yeah.
not hear you properly.
Do you have an organization like in the US? You have an organization like, taking care of elders. Do we have anything like that being planned here, given the...
Yeah, so in India, they have launched National Institutes of Aging. So two of them are already in place. One is in Delhi, which is AIMS Delhi, and one more in the Chennai. So these are the two designated National Institutes of Aging, which has already come up and working on knowing and understanding aging and also treating the elderly. So we do have National Institutes of Aging in India.
Right. We have a question from Meenal Bajaj who says 5 years ago she had a lumbar fracture, do a lot of yoga, pranayam, and take tablets, osteophos 70, calcium, multivitamin, and healthy food. Is that something that you would recommend?
Mhm. Yes, I mean, her fracture could have been since she is taking osteophos, which is a bisphosphonate medication. It is generally given in osteoporosis. So when the bone becomes brittle. Uh, so if she is osteoporotic, she's 70. If I'm not wrong, you said.
Right.
So the bisphosphonate medications are shown to prevent repeat
Oh, she's not,
fractures.
sorry, she's not mentioned her age. She said osteophos 70, not her age. She
Yeah,
did not mention, but whatever.
yeah.
Yeah.
Yeah. So again, it is to strengthen the bone, basically, and also to prevent further bone being brittle. So it is for the treatment of osteoporosis, and yes, it is recommended. It comes with its own set of medical suggestions when you take this specific medication, like because it is known to cause some gastritis and some erosions there. So you have to take it with a glass of water. So yeah, I think it is rightly prescribed.
Um, Thanks. We have a question from Sunita Verma who's asked, is sleeping in the afternoon a good idea?
Ideally, no. I mean, if you could just take the whole sleep together in the night, would be a better option rather than fragmenting sleep. Uh, so yeah, if that makes sense.
All right. Now that's something which a lot of people, I guess, a majority of the people here do not do that. So
Yeah,
is that's not going to be very easy to do, right? It also kind of,
exactly. It'll be
you know,
difficult.
because when you have a slightly, you're on your own, empty nest, there's nobody else in the house. So sleeping in the afternoon kind of takes care of a chunk of time.
Yeah. So if that is a habit and if the sleep is not disturbed in the night, if it is going well, I think we should not disturb that way. But if sleep is a issue, I mean, getting enough amount of sleep is a issue, then I think that is a time when we need to medically intervene and consider different options.
Right.
If it is not disturbing your day-to-day activities, I think it is very benign.
We have a question from Shobha Srivastava who says, I take vitamin D once a month. Should I also be taking calcium separately?
Uh, yeah, I mean, vitamin D, ideally, if you are deficient of vitamin D, it is a weekly course which is to be taken for 8 days. Having said that, vitamin D is responsible for calcium absorption, right? So if you are deficient of vitamin D, then ideally it is to be prescribed with calcium to get that stores back to replete those deficient stores of calcium. But not necessary if your calcium and vitamin D's are normal and your diet is well adjusted with the consumption of vitamin D in the food that we are consuming. There is no need to take extra calcium and vitamin D.
Right. We have a question from somebody who will not reveal the name, given the nature of the question. My husband is unable to explain anything and forgets words. What is the treatment for this disease?
Yeah. So yeah, what we're looking at is this could be an early start of a dementic process, which is a major neurocognitive disorder now they say. So if uh, if it is not affecting their day-to-day activities, if they are able to do their day-to-day activities and basic functions, activities of daily living, it could be considered as a part of normal aging, which is also called as age-associated memory impairment. Uh, but also, if this progresses very rapidly or is progressing and affecting their individual functioning or being, I think it is something that we need to look into. Doing a basic brain imaging at this point, if she's actually concerned about his behavioral patterns, I mean, her memory patterns, then we should get ideally we should have less threshold to go ahead and screen for the reversible causes of memory impairment, say like a thyroid, B12, and if none of them, all of them come out normal, then we should definitely go ahead and do a brain imaging, which is MRI of the brain.
There's one question which has come in. Since it's come in, I'm going to take it. मेरे शोल्डर में बहुत ज्यादा पेन होता है जब मैं सोती हूँ. Now, I know these are kind of questions that must be coming to you. What should a person do
Yes.
in a case like this? Should you go to an orthopedic, or should you just take a medicine or take an ointment?
See, this kind of question comes a lot. In fact, I mean, orthopedicians are basically surgeons. Okay, so they are good in joining I mean, operating or changing a knee or replacing a knee, or maybe doing surgical interventions. No, I don't mean to any offense on them, but if such kind of medical issues come, ideally it needs to be a good history has to be taken. I mean, what exactly is the nature of their issue has to be seen by a physician.
So I'm
And
going to interrupt you over
when
here. If a senior citizen has an issue, okay, sorry, I have a question. Mr. Manish Mehta asked me, what is the ideal walking speed? He mentioned that he has a 10 kilometer per hour walking speed. What is the ideal walking speed that one must have?
I think you should not be very adventurous with walking at the high speeds. I mean, brisk walking, something around 5 to 6, I guess, kilometers per hour should suffice. Again, this is again very subjective as to the health condition of the patient.
Right.
So yeah,
Yeah. So, doctor, what I was asking was that, for a person who's a senior citizen, um, and who wants to, who doesn't have a regular general physician, or even if you have had a family doctor, is it time to start looking at meeting somebody who's a geriatric specialist? Because somebody like yourself is looking at this in a different way, looking at seniors in a
yeah.
different.
In most humble of myself, I would like to say love to see patients and patients coming to me. But yes, because the whole nature and the crux of geriatrics lies in dealing with elderly, and the approach towards them is a little bit different than uh, traditional medicine is. So I would urge senior citizens to see geriatrician. Uh, so yeah, I mean, if it to sound very humble, also I would like to say that
Right, but
the more
you don't have geriatrics. For instance, you can think about, a physician. You can think about, general physicians, but you don't really know, about geriatric specialists in big cities as well. So, smaller cities, it could be worse.
yeah. So at least a good physician who is aware about the aspects of management of elderly. I think geriatric is all about medicine. In fact, it is a homecoming branch of internal medicine, is what I feel. It is the basis of what medicine was actually found upon. So someone who has more a little bit of training in elderly scenarios, elder syndromes. I think if you could consult such a physician, I think your job you should do. But ideally, a geriatrician is well suited to manage these medical issues with the elderly. Is what I could suggest.
Okay, there are quite a few questions that have come in. One is, Manish Mehta is asking before meal or after meal walking. As far as Parkinson's is concerned, I'm sorry, we're not going to be able to take this question here because we will have a special session with a neuro physician we've had in the past as well. Uh, so you can look up the archives of the Seniors Today health webinars. But just a quick question, walking before or after meals?
After meals is said to be traditionally very beneficial. So I think I have no medical evidence for it, obviously, but yeah, traditionally they say walking Shatpauli is something that all of us should do, which helps in digestion process. So I think I'll just stick to that.
Right. We have a question from Viji Ganduri who asks, can we consult Dr. Viraj online? Yes, I think you can do that at Ruby Hall Clinic in Pune. That is, the website would have his ways that can be there. Otherwise, what I'll do is I will request Dr. Kore to or somebody at Ruby Hall to give me the information. When we carry the takeaways and the video on Monday evening, the end of that will have those details, so we can do it that way. Thank you very much, Dr. Virajrao Kore, for taking time
Thank you
out
so
and
much.
for being here. As always, we will be back once again next Saturday at 5 p.m. As of now, we are looking at, since it is winter, and we are looking at having a dermatologist in the house next Saturday. So be there at 5 p.m. and we will be back then. As once again, do remember that the health webinar can you can pre-register. There is the Evergreen Club, which is there, and there are programs which happen all day, morning, afternoon, evening. You can join them, as well as the Seniors Have Talent is starting next month in January 15th. So those of you who have some friends and family who are into singing and who are 60 plus, you can be part of the entire fraternity that has been participating and enjoying themselves in the in this amazing talent recognition. And there are some people who never sang in their lives, and they've been army majors, they've had CEOs and bank officers, and a variety of people who have had, and some homemakers, and we've had amazing interaction with them through the day. So just as I was mentioning to him in jest earlier, that just as you have doctors like Vijay Kore who are taking care of seniors in a medical way, here's Seniors Today, which is taking care of engagements, and of course producing meaningful events that are there. How can you download the Evergreen Club? Well, it's there on Android phones as well as on Apple phones, so you can just look at that and download. It's all free of cost. There are no conditions apply. Nothing that you need to pay. Thank you very much, Dr. Vijay Kore. Thank you to the Ruby Hall
Thank you.
Clinic for facilitating this. We've had amazing participation from your hospital as always, and we hope to have more. And once again, all of you there, please be there again next Saturday for another session of Health Live at Seniors Today.